Looking for expert speakers for your next event? Curt and Katie Vernoy, that's me, deliver engaging workshops on clinical, legal, ethical, and business topics. Give your audience practical tools to thrive as modern therapists. Learn more at therapyreimagined.com.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt with Katie Vernoy, and this is the podcast for therapists about the things that go on in our practices, how we show up for our clients, the kinds of work that we do with clients. And Katie and I are both licensed marriage and family therapists. And over the history of this podcast, for our longtime listeners, most of you know that Katie and I don't really particularly work with couples. And when we do, it might even be reluctantly as part of other kinds of treatment, whether it be part of working with the family system. And to those of you who do work with couples, we thank you for your service and helping us to be able to round out a lot of the topics that we talk about on the podcast and getting into doing some couples work. We are joined today by Dr. Alexandra Solomon, and thank you so much for helping to come up with some of the gaps and where Katie and I can provide some guidance for people. So thank you very much for joining us today.
Well, thank you. Thank you both for the service that you provide, creating community for therapists, because as we all know, it can be a little lonely out there for us therapists. So I love that the two of you have been creating a space for therapists to come together, at least virtually, and just feel heard and seen, understood, and supported in the work that we're all doing.
Oh, thank you. That's so very nice to hear. It's you don't always know, right? What's getting out into the world. But I'll ask you the question we ask all our guests when we get started here. Who are you and what are you putting out into the world?
Yeah, well, I'm Alexandra, and I'm a licensed clinical psychologist by training. So the two of you are MFTs who work with couples reluctantly, and I'm a clinical psychologist who's been working with couples eagerly and for lots and lots of my career. And I think there's something that's so interesting that highlights that even though we have these sort of different pathways in mental health, oftentimes our degree in and of itself, tells us very little about the work that we're actually doing in real life. So I've been, at this for nearly 30 years, about 30 years, and think about my work as three corners of a triangle. So some of my week is spent in practice with individuals and mostly with couples at all stages of development. The second corner is I've been a teacher and trainer for lots of years. I spent about 20 years at Northwestern University at the Family Institute, training marriage and family therapy graduate students to do couple therapy. And I still teach at Northwestern an undergrad class called Marriage 101, which is we bring together students from all over the campus for a quarter's worth of what I call relational self-awareness training, journey into themselves, their family systems, their love lives. And I do a lot of clinician education. And then the third corner is translation. I have a podcast. I write relationship self-help books. I'm active on social media. I have been working with the media for a long time. I have a partnership with Masterclass, and it's been I just have been throughout my career really interested in taking what we do behind closed doors and what researchers do in the ivory tower and kind of walking across the bridge and making sure that all of that wisdom is available to, what I call the regular people. It's interesting. I think it's a fun time, especially I'm sure that the two of you have things to say about this. I think it's an interesting time to do that translational work because I know when I started in the 90s, it really was like if a journalist would ask me to weigh in on a story, I would weigh in. And now I, along with so many others, are just creating so much content. So rather than now teaching people the skills, I spend a lot of time helping people discern what is content that is helpful, that's relationally sound, that's based in the evidence versus things that feel kind of, too good to be true, too simple to hold the complexities of our relational lives.
Oh, you're speaking our language. We've had a couple of episodes where we talk about some of the dangers of pop psychology or even, looking at influencers and other folks, especially in our profession, potentially oversimplifying messages that maybe are too good to be true or weaponized in the wrong hands.
Right. Exactly. Which is, it's a new, it feels to me like a new problem, at least. I talk differently about that than I did, pre-social media.
One of the questions that we ask at the beginning of episodes is from a supportive place, a collective wisdom. It's not a shaming place, but what do therapists get wrong when they're working with couples?
I think, starting us off right at the beginning is I think that there are lots of us, and again, I'm glad you framed it. This is not shaming. I think there's lots of us who are working with couples who aren't trained to work with couples. And it's not, I'm not even talking about something that's unethical. It's just maybe unwise for ourselves and for our clients, much the same way that I could treat a teenager, I back in the day learned how to work with adolescent clients, but I wouldn't. I don't have enough ongoing formalized training in that area. I think one of the mistakes that people make is acting as if being a good therapist equals being a good couple therapist. And I'll tell you from personal experience, my husband and I have been in couple therapy off and on over our 27-year marriage. And I've had that experience of sitting in front of a person and being like, oh, I bet this person is a heck of a good individual therapist, but I don't feel like she's attending to the we here. Couple therapy is more than just sitting with two eyes, two individuals. It's also everything that's happening in the space between them. So that's my first thought on that.
I'd love to dig into that a little bit, because I find so many times when we ask that question, what are people getting wrong? It's oftentimes folks who don't know what they don't know. And so if you could give us a little bit more information on how to address the we versus the I, because I think that it sounds like that's a really critical component that people miss.
Yeah. When you are a couple therapist, the relationship becomes your client. And that doesn't mean that you are going to ride or die for the relationship. I think back in the day when there was research on the effectiveness of couple therapy, a divorce or a breakup was considered a therapeutic failure. And I definitely don't subscribe to that. I think that I think that it can be a really powerful outcome of a couple therapy treatment to help a couple end well. I think that the two good outcomes of couple therapy are a relationship that feels a whole heck of a lot more sustainable and vibrant, or an ending where the blast radius is contained and people are able to feel proud of the choices that they make in the ending. And I think the two negative treatment outcomes are the status quo, or an ending where people are really committed to putting the problems at the other person's feet, or God forbid, tearing each other up through the process of divorce. So I think that we need to be really thoughtful about how we define good work. That's one of the things. I'm not here to say that the only successful outcome is helping them stay together, but I do believe that the relationship is the client. So I'm oftentimes thinking in my head and asking out loud, if we think of this marriage as a third entity, what does the marriage need right now? And I use that question to kind of reorient all three of us to, it's really easy to see what you need, and it's really easy to see what you need. But the two of you are the stewards of this third thing that you've made together, this relationship. And what does it need? And that's not about self-sacrifice or self-abandonment, but rather about the pride and the responsibility in caring for the we.
So the couples that I have worked with, the answer to questions like that is, I need them to change into the perfect ideal of what I want.
Yeah. I wish they would I had that yesterday. I had a partner who so wished that her partner had just done X, and it's so simple to her that if he would and she can see how if he would just do X, it would unlock a whole new level, in the relationship. And then the question, this is where relational self-awareness comes in, is sure, it's very easy to say that if you would change, I would feel different. And braver and more interesting question is why? What feels uncomfortable inside of me about asking for it? What's the story I tell myself of who I am if I'm married to somebody who doesn't seamlessly and easily and readily do that thing? But that's the thing about a relationship, isn't it? It's just it can feel so easy and obvious to us of what the other person should do differently. I felt so validated in that idea when I heard Michelle Obama talking to Oprah when she wrote her book, Becoming. And Michelle talked about going to couple therapy with Barack and being blown away that actually the couple therapist was asking Michelle, what happens inside of you when Barack, whatever, is late for dinner? And she was like, no. The problem is Barack's late for dinner, and the couple therapist is like, and then what for you? What does that bring up for you? What do you do? And Michelle was like, this was not my notion of what couple therapy was. I think that so many of our clients have that shattering.
You've brought up relational self-awareness a couple of times. Can you describe what that is or what that concept is?
Mm-hmm. It is an ongoing, curious and compassionate relationship that we're helping clients develop with themselves. Because that becomes the steadiest, surest, most reliable foundation for intimate partnership is for two people to develop the capacity to be curious about their own reactions. And we know that the sort of, I call it like the golden equation of love. My stuff plus your stuff equals our stuff. And it's in fact, back in 2014, when Doug Sprinkle and Jay LeBeau and Doug Schneider they studied the common factors in couple and family treatment. They looked across all of the major models of couple and family treatment to find out, okay, these models are really good at telling us what they do differently, whether it's prioritizing behavior, prioritizing past, different priorities, different framings, different language, but what do they have in common? And one of the things they found that all these models have in common is every single model of couple therapy has some way of helping partners move from that myopic, simplistic, linear framing of I do this to them or they do this to me, and moving them into the language of patterns and cycles and dances. The more I do this, the more they do that. The more they do that, the more I do this. And that's basically the heart of couple therapy is it's systems training for couples, helping them move into a story of their problems and of their struggles that is cyclical, that sees how each partner has a hand in creating the very dynamic that then becomes the bane of their existence.
When you were talking earlier about self-abandonment or self-sacrifice, unlike Curt's couples that say, my partner just needs to fix themselves.
Yeah.
I have a lot of clients who talk about how often they have to self-abandon or how often they have to self-sacrifice to keep the relationship going because they don't see the other person having that self-awareness or being able to make changes. And so I find myself grappling with the question, what is in benefit of the relationship? And how do I determine if that would be a self-abandonment or would be a self-sacrifice, and how to kind of go through that process of determining potentially, is this sustainable? Is this something that I can actually do? But also, if one partner feels at least that they are doing all this work to try to serve the relationship and don't feel like they're met, it can be very isolating and a lot of folks get very bitter.
Absolutely. I wrote my first book in 2017 called Loving Bravely. And I was blown away that very question, Katie, that you just posed is the question I got over and over again. Like, I'm here for this. I'm doing the work. I'm listening to the podcast. I'm in the therapy with Katie and my partner is not. So I spent a lot of time wrestling with this. And I mean, so many answers. One is it's why it's so important, I think, for all of us to continue to normalize therapy so that then a person who's like, babe, can you please, can you please hold up a mirror and learn more about yourself? It's like, I guess I'm going to go to therapy. And it's not like that big of a deal. That's one kind of easy answer is we want everyone to be willing to do this work. And then there's another answer, which is, yes, I do think there are these really sad cases where people outgrow each other, where it's like the amount of me that I can't figure out how to fit into this we, it's just too big. There's too much of me that I don't know how to bring to you, that you don't know what to do with, that I'm actually doing us both a disservice. I think that's also one of the things that is very real and happens. But there's a lot of us in the shades of gray in the middle. So one of the ways I've been talking about this lately, I've started to call it this effort mismatch, because there very often is a person, I call them the change person, and they're there week after week in Katie's office, and they're listening to the shows and they're reading the books and they're doing the journaling. And that's a kind of effort that is saying, my life and my relationships and myself are these forever works in progress. They're iterative. We're always peeling back a layer. We're always growing. We're always trying to figure out how to be 1% better. Beautiful. That's beautiful. But there is another kind of effort that I see people do. And that's what I call the acceptance partner. And that's the partner who does keep their eye on all the ways in which this is actually a pretty freaking beautiful relationship. There's a lot going right here. There's a lot that is simple, but also really quite whole and wholesome and nurturing and sustaining and sustainable. And so that's a kind of effort too. And I kind of use like a gym analogy, that sometimes effort in the gym is you get on the treadmill and you run intervals. That's one kind of effort. But there's a kind of effort also that's holding a plank. That's a kind of effort, that steadiness and that sureness. And I think that change people and acceptance people are sort of drawn to each other, or somehow end up together. And it's very easy for change partners to miss the kind of emotional contribution that their acceptance partner is making by appreciating what this relationship is and has been doing for a lot of years. But I'm super interested in hearing how that lands for you.
This all sounds really lovely and wonderful. And I think, part of what has scared me off of working with couples a lot in my practice is that oftentimes the level of contempt that is coming in by the time that couples actually enter into therapy. These all sound like really wonderful principles when things are kind of status quo and things are going fine and people are wanting to deepen their relationships. For people who are coming in already very high conflict, how do you help to be able to open up some of this?
Mm-hmm. Mm-hmm. Yeah. It is. I mean, when people are coming in high conflict, what they're telling us is that they are too dysregulated to have conversations that have any measure of curiosity, introspection, empathy, right? So I think the first order of business is helping people learn how to regulate themselves. Because as a couple therapist, there are things that we can do to hold the frame. We can, do things and, we can do our little famous timeout symbol, talk only to me. We can see them individually for a while if it's too heated together. There are things we can do to contain, but we also need to be teaching self-regulation skills and helping people recognize when they are not regulated. Because, I think about Gottman's research where he found that even couples with high relationship satisfaction scores, once they get into that dysregulated circular place where they feel too unheard to listen, they feel too unseen to be able to witness the other one. Once they're in that place, it's actually really hard for even happy couples to move back into regulation. So those regulation skills are important. I spend a lot of time talking to people about, these difficult conversations need to be like micro-dosed and to not keep going past those thresholds. Because I think you're right, Curt, that the more people engage in contemptuous behavior with each other, the more then the mere presence of the other is a dysregulating cue. It's like the threshold gets lower and lower and lower. So the first order of business very often is working with people's bodies, working with helping them just have experiences of being calm near each other and creating more capacity to be calm near each other. It's also why we oftentimes are having people ideally working in individual therapy. I feel like I'm oftentimes the quarterback of a team. I'm working with a couple and they each have individual therapists. And then to the degree that I'm able, I'm coordinating that team, because you're right, Curt, there's such deep intrapsychic old stuff that gets kicked up in our intimate relationships that also needs to be addressed in more of a one-on-one setting.
That's one of my favorite things to do, is working within one of those teams and having a couple therapists talking and working on the larger picture, and then working with one of the members of the couple on the deeper stuff, the individual stuff. And I find so often that in the individual work, and so I'd love to see how this shows up in the couple work, that being able to identify some of the partner's stuff and understanding more of the context of the partner and providing empathy and compassion and being able to move into a place of, and maybe this is more of the acceptance piece of it, but being able to put more context around and even see their partner as a human versus an adversary. It seems so powerful, and being able to see how that comes back to the couple therapists that I work with, and how they show up differently, or they don't show up differently, which is also very interesting, in that they've got these grand ideas in individual therapy and they don't show up in couple therapy. But I'm curious what your thoughts are on all of the traumas and the baggage that's being brought in, and how that, if it's addressed in individual, how that shows up differently in couple counseling.
Oh, I think it's so helpful. I think it's when I'm doing clinician education, I find myself oftentimes talking to therapists about what Al Gurman called many years ago ITCP, individual therapy for couple problems, which is something that we oftentimes do, right? We're working one-on-one, but our clients are talking about their marriages. And I know even me, as somebody who teaches and trains couple therapists, in my one-on-one cases, when my individual client starts to talk about his or her marital dynamics, I feel my own loss of systemic framing, right? Because I think we become such fierce advocates for our individual therapy clients, we get skewed. We start taking our client's psychic reality as capital R reality. We stop inquiring about the partner's perspective, what the partner would share with us if they were here, the ways in which our individual client is contributing to that dynamic. So I think it is, I hear you that when we have that collaborative team, the couple therapist can, just give some perspectives about how our client is showing up in the couple work. But even we could do that. Even if we never talk to a couple therapist, or if there is no couple therapist, we can talk to our individual clients by asking questions like, I'm just thinking about what your partner would say if they were here, or let's imagine, or let's role play it together. There's ways that we in one-on-one treatment can keep that relational frame, which ultimately helps our individual clients, because if all we're doing with our individual clients is kind of like waxing poetic on how this would be so much easier if their partner would be different, we're ultimately disempowering our own client, right?
For sure. For sure. I think it's something where there's so much to talk about here, but I'm just recognizing that whether it's through individual therapy or the work to do the self-regulation, those types of things, it feels like that's the beginning of the work. It's
yes,
understanding myself, understanding how I can take care of myself so that I'm showing up in the best way I can, be the best partner I can be, show up how I want to be showing up. And then what? Because it feels like that's just the tip of the iceberg, really.
Mm-hmm, mm-hmm. It is, when we're talking about couple therapy, we're talking about those, like, helping people be more regulated in conversation with their partners, right? That is one piece of it. It's sort of the top-down interventions, and the more regulated people can be, then the safer it becomes to start to connect the present to the past and understand that, as Terry Real says, we marry our unfinished business, right? So many of the models, whether we're talking about imago therapy or insight-oriented therapy, so many of our models are about those connections to the past. And so I have a tool that I've been using for years and years and years called a vulnerability cycle map. It's from Mona Fishbane and Michelle Shankman. They developed it in 2004. And that map is my favorite tool because it helps me as the couple therapist understand the psychology of partner A, the psychology of partner B, and the dynamics between them. And we look at what was the role that each of them played in their family of origin. what was their kind of core vulnerability, their sort of core wound from childhood, whether that was feeling not prioritized, not seen, not kept safe, not believed, overburdened. Like, what was that kind of emotional Achilles heel, that sensitivity that they developed in childhood, that they are scanning the relational, dynamics for, to, God forbid, feel again? And then what's the survival strategy? What's the behavior? That, like, 4 Fs: fight, flight, freeze, fawn. What do they do when that gets triggered? And by mapping, I make the map, show my clients the map, we're looking at the map. That becomes our map of our work together. Because then we can recognize, oh, wait, you're moving into a survival strategy. That must mean something here feels pretty darn threatening. What is it? Then we can start to work backwards and understand how the past and the present is getting all kind of jumbled up together. And then we're creating new experiences, new versions of how to speak from the vulnerability, how to, like, talk about what's happening inside, like in taking accountability, inviting our partner's tenderness instead of harshness, and creating a set of new experiences that then, hopefully help them move away from that place of contempt. But as we know, when couples come in and there's high contempt already, that is true. I mean, what Curt's speaking to is a reality. Oftentimes couples have waited so darn long. I oftentimes think, like, oh my gosh, you guys, like, it's like you're here with a very, very advanced disease progression, and now I'm going to have all my own feelings about how hard it is to help you change course. So certainly that is real, that I think all of us ought to be shouting from the rooftops for couple therapy early and often, because patterns that are well cemented are harder to change than when we get a young couple who's engaged or, newly married, and they're trying to set down good habits.
Need dynamic, knowledgeable speakers for your next event, training, or conference? Curt Widhelm, that's me, and Katie Vernoy, that's her, bring real-world expertise to every presentation, covering topics like supervision, private practice growth, and therapist burnout. Our workshops are interactive, insightful, and packed with actionable strategies to help modern therapists succeed.
Whether you're planning a team training or a large-scale event, Curt and I deliver high-impact learning experiences tailored to your needs. Book us today. Visit therapyreimagined.com to learn more.
What does your between sessions work look like, as far as homework assignments, as far as contact with the couples in between sessions? And I'm curious just about kind of the structure, especially in the early stages of therapy, where some of these skills are not yet really embraced, or they walk out the door and they have at least the cognitive knowledge of what's going on, but maybe not the ability to apply it.
Yep. I don't assign homework to every couple every session, but especially early on, when one of the functions of homework early on, I think, is helping people feel a sense of agency and ability to make change. Because couples, I find this, I'm interested if you guys do as well, couples oftentimes come in with more shame and more kind of hopelessness and despair. And that's not just because the problems have gotten so bad. I think it's because there's just a collective shame about couple therapy. It feels like a breach of the romantic myth that this should be easy. So what I want couples to feel quite early on in our work together is a sense of pride in what they're doing to invest in their relationship. So the homework early on is also to help them feel like they're actually doing something, they're investing. So I sometimes will have them listen to something I love. I love this old exercise called the Caring Days exercise, where couples make a list of these 10 things that when my partner does them, I feel loved. So we're building a little bit of positivity between them. We're building a sense of, like, that they have the power to make this different. And I will say, okay, I'm giving you this homework. When you come back next week, I'm all ears for all the ways that it was hard, it went wrong, you didn't do it. Like, whatever happens, and we deal with it, So I'm careful to not set up the couple to feel shame or self-consciousness if they don't do it or if it goes poorly, but rather just to start to help them get used to this idea of investing in small ways in their relationships.
I'm thinking about, I guess this is the beginning of treatment, but may or should, I guess, continue to evolve, but goal setting and where we land, because you talked about earlier that there's not just one positive outcome. The relationship is stronger and everyone's great. That potentially there is an outcome where I've heard the term conscious uncoupling, or a very positive close to a relationship. But how is that developed? The reason I ask is I've heard couples talk about wanting to find that way out the door, and their couples counselors like, I am the champion of your relationship, or vice versa, where the couple's saying, this is hard, we're not making a lot of progress, but we are still committed, and our couples counselor is telling us maybe we might have to separate. And so it's I'm just wondering how that alignment happens and how that conversation goes, because there's couples that have potentially very realistic or very strong convictions, or they might have very unrealistic expectations and they don't understand the capacity of the relationship. And so I just am curious how that goal setting can work.
I think, well, I remember years ago having two really experienced couple therapists in the field doing a brown bag lunch together. And they got into this debate about whether or not they tell couples to divorce. And one of them was like, absolutely, I do. I'm like, you guys, there's nothing good here. You guys got to get out. And the other one, is a feminist couple therapist. And she was like, I'm not in charge of people's destiny and their life choices. So it was in that moment where I was like, oh, wow, smart minds differ on this one. But I'm of the camp where I don't have a crystal ball also. And I have been blown away time and time again in my years of work at couples where I thought we would make pretty steady progress and we were quite stuck, and couples where I thought this is going to be really, really hard, and I watched them turn things around. So I don't know. And I don't know that we as a field have a really great sense of that. So I want all of us to be cautious about staying very near our couples and continuing to have conversations about how this is feeling, and neither making promises nor making prognostications, but just to stay quite near our couples and to really see ourselves as like truly like fellow travelers, that we are in this together and we don't know what's possible. And the thing we know for sure is that the most powerful variable for change is the quality of the connection between the therapist and the couple. So can we as a couple, as the couple therapist, can we have the capacity to be with them in questions that don't have easy answers? And if they're looking at us and saying, tell us what to do, especially for those of us who grew up in family systems where we were like the perfect child or the parentified child, we will grab our cape and tie our cape on and we'll be like, I'll tell you what to do. Da, 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 Can we be humble enough to say, I don't know, but here's what I do know. We're going to show up every goddamn week and we're going to keep working on this. I'm in it with you. And we don't know where it's going, which doesn't mean I'm not in charge, right? I can be in charge of the space. I'm holding the space. I'm holding the frame. But I don't know where this is going because I can't know where this is going. So can we be comfortable with that discomfort? I think it's the most truthful thing that we can do. But I'm super curious how that lands for you guys.
I love that answer because I feel like that's the only thing we can do. It feels like if the therapist takes the lead to the point of dictating what should happen with clients, that's just bad therapy.
I think it oftentimes just reveals the therapist's discomfort or the therapist's biases, right? Sure, you would not last 7 minutes in this marriage, but guess what? That's not your marriage. And your client didn't come in to say, do you want this marriage? No, the client came in to say, can you help us with our marriage? And we don't know. We see them for 50 minutes a week or whatever, 60 minutes a week or however long we work. That's the window that we get. And we have to understand and be humble about the fact that the way they show up for couple therapy isn't an exact isomorph of how they show up for the days and hours and weeks of their lives. And that we have I spend a lot of time training couple therapists to really get in touch with the romantic myths that we've internalized about love, that make us have some version of our partner ought to be this for us or do this for us. Because those myths and those beliefs shape how we track progress. But my belief is that we have to help couples optimize the marriages that they are in and really understand the rules of their marriage. This is not about, endorsing abuse or any of that kind of stuff, but just about that there actually are lots of different ways to have a marriage. Marriages get to be graded on the terms that the couple comes up with.
Has your work over the years changed with things like ethical non-monogamy, more open relationships? How has that impacted the way that you work, the way that you conceptualize things?
Certainly. Yeah, I think it shifted in my teaching and training, in my own learning. If I had, I am learning, I continue to learn alongside my couples, around how to open up, what works, what are the best practices around ethical non-monogamy. But I think I guess I would say what I love most about this moment in our field is whether a couple is choosing sexual monogamy or choosing some version of non-monogamy. What I love is that we are now having that conversation more often and talking about the risks and benefits, no matter where a couple puts their sexual boundary, rather than it just being, if you are a couple, of course you are sexually monogamous. And of course, everybody knows exactly what that means. I think it's so much healthier when we as couple therapists are asking about where the couple sexual boundaries are, why they are there, how they've had conversations about where to put them and why they're putting them where they put them. So I think it's a really important, I think there's so much richness that comes when we help couples make intentional choices rather than these knee-jerk kind of like plug and play versions of relationships.
We have a conversation with someone that talks about ethical non-monogamy, polyamory, and so we'll link to that in the show notes over at mtsgpodcast.com. But one of the things that you're talking about here that I really appreciate is this idea there's not rules, there's not these other things. It's what are the agreements?
Yeah.
And it really gets to the concept you were talking about, which is what is the relationship in front of you and how have the people within that relationship been able to set things together, and which of those things are healthy and which of those things might be tied to these past traumas or past relationship patterns that they're recreating, and teasing those things apart from a very objective place sounds like really rich and rewarding work. What are the core concepts that you think that all couples therapists need to understand? What are the things that you want people to take away today? And then maybe you can talk about a fantastic course you're putting together that they can also get these concepts.
Okay, the core things are, I want all of us couple therapists to be right off the bat mapping each of our clients' genograms and family trees, understanding, the families of origins that our clients grew up in. I suppose if you practice from a purely CBT lens, maybe you don't need that. But to me, it's pretty hard to do couple therapy that can make meaningful change without understanding family of origin patterns and how those shape present. I want couple therapists to always be talking about sex early in the couple work, even if their presenting problem has nothing to do with sex. The research shows that we as couple therapists are frequently reluctant to bring sex into the room unless our clients do. But the bottom line is our clients are going to be reluctant to bring it up unless we do. So to have that as part of every get to know you process as a couple therapist, to just normalize that this can be in this space. It doesn't have to be front and center, but it's welcome. Conversations about your sexuality together are welcome here. I want couple therapists I think especially with couple therapy, because there's so much in the room with you, it's really tempting to reach for technique and script and to know that most of our power is in our willingness to stay near and stay curious. And one of the things that we need to mostly be curious about is our reactions to our clients. If we start feeling like we don't like one of the partners in a couple, or we're having a hard time connecting with them, to get curious about that. I think it can feel kind of shameful to a couple therapist to not like a client or to feel judgy of a client. And so we sometimes will push those feelings away. But there's an awful lot that we can learn and we ought to be paying attention to about why we're having a negative reaction to our client. It might be something about us, what they remind us of from our own past, but it might be something about a survival strategy that they're using in their relationship that feels off-putting. So then we may have to double down on understanding the tender underbelly that is driving that, yucky behavior so that we can reach for that. Because, right, that's how people change, is when we reach for their, when we reach for their goodness, or we reach for their humanity, their dignity. So those are some of the things I think about.
Where can people find out more about you and your work?
Yeah, well, I'm so excited about this new. So I'm launching with PESI and Psychotherapy Networker a couple therapy certification course, and we'll make sure that you have links to that for your listeners, because this is, if you didn't have formal training in couple therapy, or if you trained in one model, my approach really is integrative. I've been training as an integrative clinician for years, so this is a way of kind of weaving together the best of a number of approaches. And we cover not just the process of therapy, but common topics. We talk about developmental transitions and problems around sex and problems around domestic labor and domesticity and in-laws and parenting. So we're doing kind of across the course of therapy, as well as diving into topics and populations and problems. It's a really comprehensive course that has been so exciting to make. And I did interviews with couples, so you see me in action working with couples. We'll meet live throughout the course. And it's a certificate that then becomes part of how you position yourself within your practice and within your community. And we get to keep in touch then, because the certificate is good for 2 years and there are continuing ed requirements. So we will get to keep learning together.
And we will include links to those in our show notes over at mtsgpodcast.com. Follow us on our social media, join our Facebook group, the Modern Therapist Group, to continue on with these conversations. And until next time, I'm Curt Widhelm with Katie Vernoy and Dr. Alexandra Solomon. Want expert training for your team or event? Katie and I offer engaging workshops with real-world strategies for modern therapists. Visit therapyreimagined.com to learn more and book today.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.